psychology doesn't have a kind of a scientific objectivism. You can look at blood pressure statistics and see if your blood pressure is higher within normal limits. You have objective external criteria against which you can measure. The only thing that they have is the Diagnostic and Statistical Manual of Mental Disorders. And that is a fluid thing, and it's always changing, right? Because we're at DSM 5. And between 3 and 4, and then 4 and 5, there was some significant political things that were going on.
This will be a controversial but also fascinating thing, was that in 1952, APA listed homosexuality in the DSM as a sociopathic personality disturbance. And then in the second publication of the DSM, they identified that by the 7th printing of it, that it was no longer listed homosexuality as a disorder. But then it returned back in the DSM-3. And once then it came back into 3, then there was this big old debate about whether or not it should be a disorder. And it was more honestly politically motivated than it was anything other than that.
The group that comprised basically the editors of the DSM are actually a very small group, and they tend to be kind of homogeneous in their philosophy.